name's Robert Demeff. I'm a sports medicine physician with Texas Orthopedic Associates. And I'm going to talk today as an introduction to regenerative medicine techniques. There's a lot of information out there and a lot of misinformation out there about regenerative medicine. But what I want to do is get an overview or an introduction about this hot topic. Now, in general, there have been healing responses that have developed and evolved over the course of 500 million years. Animals have been roaming the planet literally for 500 million years and have been injured. And during that time, we've evolved to develop mechanisms to repair the tissue damage, whether that's a bone, cartilage, ligament, tendon, muscle. So there's these healing responses that occur that take time. In general, when a person has an injury, there's a bleeding that occurs. And that blood to the area starts this cascade of healing. That leads to some inflammation, white blood cells, and that helps further stimulate the tendon, ligament, tendon, muscle to repair itself. Then there's this proliferative phase that occurs where more and more cells get recruited and they start to repair the process. And then finally there's this remodeling that occurs in the tissue over the course of many months and oftentimes years. And so that's why many injuries that people have, they'll be bothered by it for 1-2 years or longer because it takes a long time for these to occur. And oftentimes, as we age, these processes are slower or take longer to recover from. So as we become older, we have to be a little bit more patient with our recovery. Now, in general, when we think about treatment for injuries, the first thing is we have to make sure we have the right diagnosis. So that requires a good history, a good physical examination, and oftentimes imaging studies, whether that's x-rays, ultrasound, MRI scan, CT scan. But in general, with a good history and physical, we can figure out what's wrong with the patient and prescribe a treatment program. The other thing that happens when you have an injury is there's all sorts of compensatory patterns that occur. People start to move or change the way they're doing things, and so they'll get other injuries. So you might have an ankle sprain, and the next thing you know, because you're limping around, you get back pain or shoulder pain. So as you're evaluating these issues, we have to take that into account. Another philosophy that I have is we try to use the least expensive, non-operative, non-invasive techniques that have the best research behind them with the least side effects. So we start slow, so to speak, and work our way up to techniques that are more expensive. The other thing that's powerful for treatment is the placebo effect. And placebo effect does not mean a fake response. It's a very real response. And what it has to do with is the fact that the brain changes the response to an injury based on the person's perception. And it's a very real effect that's been very well documented. And so a lot of things that we do, we take into account this placebo effect, just simply saying, hey, if you do this, you will get better. And that works oftentimes 30, 40, or 50% of the time, depending on what we're doing. Now, what about treatments for these injuries? So the first thing is, people generally have to be on a good physical therapy rehabilitation program. So you want to have a good therapist working with you. And we know that proper exercise will actually stimulate the injury to repair itself in a more healthy fashion. You can't just ignore it. If there's an underlying biomechanical issue, person's doing something wrong, or there's an imbalance in the muscle tendon units, the joints, those need to be corrected. And oftentimes, a variety of healthcare professionals can help you with that. We use medications, pain medications, which don't really help healing, but by inhibiting the pain, the person can do a better job with their physical therapy. There's a variety of supplements, natural anti-inflammatory supplements that may help. Things like glucosamine chondroitin, and turmeric, and cherry juice extract, and ASU, and SAMe, and MSM, and so on and so forth. The list goes on and on. There's a lot of natural anti-inflammatory supplements that help with healing response, depending on what the problem is. Local modalities, heat, and ice, and compression, and some of the physical therapy, athletic training modalities such as electrical stimulation and ultrasound and galvanic stim and vibration therapy, all these techniques can help with tissue recovery. Manual techniques, masotherapy, aerosty, active release techniques, these are all manual therapies that can help the body recover. We don't know exactly why that occurs, but these techniques can be very helpful. And so your treatment regimen oftentimes includes lots of different healthcare professionals to get your body to heal most efficiently. Now, some of the things I'm going to talk about now are more medical treatments that a physician may prescribe. The first one is nitroglycerin patches, which the way they work is they actually will stimulate a tendon to repair themselves. And the way they do this is by increasing cell apoptosis. And cell apoptosis is what we call programmed cell death, where the cells die, They release growth factors, and those growth factors stimulating a healing response. Now, it doesn't happen overnight or in a few weeks. It takes a lot of months, but these can be very helpful for tendon problems. Prolotherapy is another technique that's been around for 100 years. Prolotherapy stands for proliferative therapy, and the idea behind this is we inject compounds, and these compounds, whether it's a sugar molecule or salt or tannic acid or polydocanol, there's all sorts of things we inject into an area, and it stimulates an inflammatory healing response. Shockwave therapy is another technique that can help tissues recover. And the idea behind this is use high energy ultrasound waves, and it hurts. We damage that muscle tendon problem, and that stimulates a healing response. Hyaluronic acid is another regenerative medicine technique that a lot of people don't call regenerative medicine, but it actually is. Hyaluronic acid is a disaccharide. It's 2 sugar molecules. It's everywhere in the body where it's a structural molecule, but it's in the joint cartilage, and research has shown that these actually stimulate cartilage cells to become more metabolically active, and there's actually evidence that it helps with tendon repair as well. So even though a lot of people don't use it for tendons, hyaluronic acid can help with tendon repair also. PRP, or platelet-rich plasma. This is a technique that's been around for 40 years. It's more popular now, and essentially what we do is we draw your blood, we spin it down and concentrate it, and then we collect the platelets, and the platelets have a lot of growth factors. And these growth factors stimulate the body to repair the damaged tissue. The next are mesenchymal stem cells, or MSCs. And this technique was elucidated 30 years ago or so. And the idea behind this is that these cells are precursor cells that will get your tissues to repair themselves. Now, we have a number of sources of so-called MSCs or stem cells. And the first are embryonic stem cells. There's a lot of ethical issues with this, but basically it's taking embryonic tissues and these immature cells and creating something out of them to help with tissue repair or build an organ, etc. There's something called adult-induced pluripotential stem cells. And in that case, what we do is we take an adult patient and we manipulate their cells, or the scientists manipulate their cells, and they end up resulting in tissue development and tissue growth. Those 2 techniques are really not done clinically. They're in a research mode. The third source are fetal cells, and there's a few places where people can get fetal cells and fetal fluid. You can get it from the amnion, which is the sac around the fetus. You can get it from the amniotic fluid. You can get it from the umbilical cord. And the fourth source of so-called mesenchymal stem cells is actually from the human body itself. And these aren't really necessarily stem cells, but we can collect cells from your bone marrow, from your fat, and in other countries, not the US, but in other countries, you can get it from peripheral blood, you can get it from the lining of the bone, you can get it from the joint capsule. There's lots of places to get these cells. And then what we do is we manipulate them a little bit, and then we re-inject these into the area, and these cells will result in a healing type of response. Now, in some countries, not in the United States or Canada, people will actually take those cells and grow them in culture and expand those and make more of those, with the idea that, hey, if we put more cells in there, maybe we get a better healing response. A brief word on amniotic tissue and umbilical cord. The amniotic tissue and umbilical cord have a lot of cells in there. There's a lot of growth factors. There's hyaluronic acid. There's these other compounds as well. And these tissues can also be utilized to help with a healing response. In general, if you're getting amniotic products, there's no viable cells in there. Those cells are not living, but there are growth factors. However, if you get umbilical cord type of treatment and it's done properly, there can be living cells in there which can differentiate and help with your healing response. So that is a brief introduction to regenerative medicine techniques. There's others out there as well, but I just wanted to introduce this topic to you, and we'll have further discussions, and you can link to some of the websites that will be associated with the end of this video. Thank you.